where do you think we are as a country on that rollout of the vaccination?
Well, nationally, we're not doing very well. We've only vaccinated about 5 to 6% of the U.S. population. Things are moving too slowly. We need to really ramp up to around 3 million Americans per day in order to reach 3/4 of the U.S. population by the summer. So we're only at about a third of that rate. So things really have to pick up, especially with the new variants emerging. This may be our one chance to make an impact nationally, especially with the numbers kind of going down right now prior to the new variants coming in. So now sort of a weaker point in the epidemic. It's still very strong, but it's declining to under 200,000 new cases a day. So now's the time to really capitalize. Now's the time we got to hit this epidemic hard with vaccinations, and I'm worried that it's ramping up too slowly.
I think the Biden administration's goal is 1 million per day for 100 days. It sounds like you're saying that's good, but it's not enough. It's just simply not enough.
Yeah, no, it's not good and it's not adequate. It's too low a bar. We need to be at around 100 million immunizations per month, and in order to get to that target of roughly 500 million immunizations by the summer. And that number of 500 million is based on 3/4 of the U.S. population to interrupt virus transmission. That's 240 million Americans times 2 immunizations. That's where we get the 500 million. And we're not going to get there with that 100 million over 100 days. It's simply not adequate.
In terms of the shortage of the vaccine, I know Moderna and Pfizer, they're trying to ramp up production to get more out. Johnson & Johnson expected to release theirs in a couple weeks, according to Dr. Fauci. But how would you describe the state of where we are in terms of the supply? Is it where you'd like it to be, or are we seeing shortages here and in other places?
We're seeing deficits in all aspects. We're seeing deficits in terms of our ability for doing high throughput vaccinations. People are still calling frantically to the pharmacy chains and hospitals looking for a vaccine. We need more hubs. Second, we need a greater supply of vaccines. We will not do this with the mRNA vaccines alone. I've been saying that since the beginning. We have to get the J&J and the AstraZeneca Oxford vaccines up right away. We have to get the particle vaccines from Novavax. We have a recombinant protein vaccine that we'd like to get into this mix. All that has to happen if we're going to reach that very high bar of a target in order to save lives.
In terms of who is getting the vaccine and what it takes to get a vaccine, I think you tweeted a couple weeks ago, maybe last week, about the inequity of a lot of this, because it's a lot of online appointments, and I think my news director described it as like the Hunger Games to get a vaccine, the digital Hunger Games for folks, especially that are 65 and older. Many of them might not have access to a computer or things like that. Do you have any issues with how that is being handled and who is getting it?
It's got to be streamlined and simplified. You shouldn't need to necessarily be computer literate and understand computer passcodes in order to sign up for vaccinations. We have to make this simpler so that anyone who wants to get vaccinated can get vaccinated, and that's how Israel has done it. Israel is now vaccinated almost half the country, and they'll be fully vaccinated by March. We're not anywhere close to that. Now, admittedly, it's a much smaller country, but the way they're doing it is they're making it easier to get access, creating big hubs, and they ensured the vaccine supply. So we've got to take some lessons learned from Israel and do this on a larger scale in the United States.
You know, a few weeks ago, I think you had some complimentary words for the city of Houston and how they were able to ramp up some drive-through clinics and vaccinate a couple thousand, I think up to 5,000 last weekend. As a whole, how do you think the city of Houston, Harris County, is doing it in terms of its rollout with the limited supply they have? We know that's a big caveat.
I think Houston is doing better than most other parts of Texas right now. I haven't seen the latest numbers for Houston. Immunizations, Texas as a whole is roughly the same as the rest of the country. Even though we've given, I think, 3 million doses of vaccines on a population, or immunizations on a population basis, we're about the same is the rest of the country. So we have to, and at the state level, we have to pick up our game and achieve higher targets. I think Houston's doing better than most, but we still have a long ways to go.
Are you hopeful that we can reach that 3 million threshold? And what I guess the question is, what needs to change between now and a couple months for us to hit that target?
3 million a day. Well, all the stars have to align. We need to expand the number of vaccine hubs. We have to streamline the guidance and make it simpler to understand and implement and operationalize. We have to have more vaccines out there. We have to communicate better with the American people so they understand some of the complexities of the vaccines and the different effects of the vaccines, in which we'll need boosters, third doses down the line. And we have to counter a pretty aggressive anti-vaccine movement, which is especially strong here in Texas. I have an article kind of spelling out this aggressive rise in anti-science that'll come out later this week. So maybe that's something we can talk about later. But a lot of things have to happen for it to work. And right now, even I think it's great the Biden administration has proposed a national program, which is what needs to happen. There's still a lot involved in that we're not realizing at this point.
A few weeks ago, you laid out some basic numbers you just did on the back of a sheet of paper of counting how many vaccines we would have to do daily here in Harris County, Houston area, just ballpark figures. Have those figures changed, and could you walk me through that in terms of getting us to a point where we reach herd immunity the quickest?
Yeah, I mean, my numbers are looking at the population of Harris County. And admittedly, there are other components to Houston other than Harris County, but looking at Harris County, 4.8 million residents, one of the largest counties in the country. That's 3.6 million people we need to immunize. If we want to do that over 6 months, that's 600,000 people a month. That's 1.2 million immunizations a month. Divided by 30, it gets to 40,000 a day. And that's a lot. It's a really high bar. And I don't think we're close to that at this point. So those are the numbers that we're going to have to get to.
Okay. Two quick closing questions. Overall, the state of the pandemic, I heard you say that we're still in a dark place, but we see it's gone a bit of a dip. Do you foresee that continuing?
No, we may dip a little more, but I think what we're going to see then is some of the pickup from the UK variant, South African variant, the Brazilian variant, the new one in California. I think all those are going to pick up and we'll start going up again. That would be my prediction. When that happens, I can't really say. So maybe things will continue to decline for the next few weeks, but that's like the eye of the hurricane that we're passing through. The next big piece of this is coming. And again, this is the time. If you want to hit this epidemic hard with vaccinations, this is the best time to do it.
And the vaccinations that we've seen so far, do they have an immediate, do we immediately see that impact in terms of cases going down, or is it more people wearing masks or being more
we won't see the impact with the kinds of numbers we're immunizing now. We've got to really ramp that up. So, as we get to 20, 30, 40% of the population immunized, we might start to see an impact, but certainly not at these low levels.
Do you believe historically we were able to get to that level of vaccination, or is this like a completely uncharted territory for the United States public health system to try to get this level of vaccination so quickly?
We haven't done adult vaccinations on this scale since I can remember. Historically, there was an effort to vaccinate all of New York City against smallpox when smallpox broke out. I think it was 1947. It was kind of a one-off thing. In terms of big campaigns, we did polio, of course, in the 50s, but those were childhood immunizations, and we were able to tap the school system. We've done meningococcal outbreak vaccinations, but again, that pales in size and scope compared to what we're asking the American people to do now. People often compare it to the flu vaccinations. They say, "Hey, Dr. Hotez, we've done flu vaccinations before, and that's 80 million doses And you're right. I think 80 million doses over a few month period is an important milestone. But again, it pales in comparison to the 500 million immunizations now we're going to need over the next 5 to 6 months.
And just wrapping up here, what is the biggest concern you have about how this all is going right now? What is the thing that keeps you up the most at night?
My biggest concern right now is complacency at the senior leadership of the country. That somehow they think 100 million over 100 days is adequate, or that they think that reaching 600,000 deaths is somehow acceptable. It's not. We've got to do everything we can to not reach that 600,000 benchmark.
Ready. I appreciate your time, Dr. Hotez, and your expertise as always.